I'd like to thank everybody for joining today. We're excited to share the information. Because we know the season for illness business is short and unpredictable, because of these factors and the margin for error being low, we are at Kinsa working hard to make the season predictable for the companies that are working in this space to succeed. And that's really the topic that we're going to be discussing today. Given the topic is illness, I want to start by letting anybody know, anyone who's in the top 6.5% of people who are ill in the US today, there's some good news and some bad news. The good news is illness in the US has peaked this season. So you should be surrounded by fewer people that are a source of infection around you going forward. The bad news, unfortunately, is if you have children, illness is going to actually be around you almost all year. And the reason I say that is the Journal of Clinical Infectious Diseases reports if you have one child in your home, you'll have a virus in your home 18 weeks of the year. And if you have 2 or 3 children, you'll have a virus in your home 29 weeks of the year. So you barely get a reprieve. Now, before we move to today's presenter, I'd like to cover a couple of the logistics for the webinar. My name's Chad Hinkle. I'm the Area Vice President of Sales for Kinsa. What we're aiming to do today is be really respectful of your time. We're going to spend about 30 minutes talking about how Kinsa can help CPG companies, retailers in the cough, cold, and flu space. If you have any questions during the presentation, please use the portal at any time to ask them. We have dedicated time at the end for answering questions, so we will hold them, but we will definitely answer them at the end. Also, the recording will be distributed to everyone at the end of the session. And then I also want to let everybody know that today's webinar is the first in a series of 3. The following 2 webinars are going to focus on how Kinsa turns a real-time illness signal into a consumption demand signal. And then the third webinar is going to focus on how Kinsa helps companies recognize extreme exceptions before they actually occur, so you'll have time to take action. With that, I want to introduce Brad Pope, who's the Head of Customer Success at Kinsa. And Brad's going to be presenting the technical portion of today's webinar. To give you an idea of what Brad has done in his career, he spent about 25 years in supply chain management, operations management, and customer service, specifically working in the software space with software and analysis tools over the last 15 years. In terms of what we're covering today, we'll start with a quick Kinsa introduction for anybody who's not familiar with Kinsa and what we do and how we get the signal that we use to help companies. We'll talk about the retailer-specific insights that we've built. And then finally, we'll move to a question and answer session. To give everybody a foundation for what Kinsa is and where the Kinsa illness signal comes from, what Kinsa does is aggregates millions of real-time illness readings into a health weather in every geography of the United States. And those readings come from a combination of smart thermometer and a smartphone app consumers use when they first start feeling symptoms of illness. The app and thermometer combination, they really provide guidance to help the consumers understand 2 key questions. Number 1, is what I'm dealing with serious? And number 2 is what do I do next? And so this is a basis of trust that actually lets us continue to have consumers turn to us when they experience the symptoms. In terms of coverage, we have sensor coverage in every DMA, which is in line with the population density in the US. In terms of the scale, there are about 1 million households in the network and 2.5 profiles per household. And to give everyone an idea of what this means for us in illness season, Kinsa is receiving about 50,000 temperature readings per day and 15,000 symptom reports per day during the illness season. Very high signal coming during illness season, actually from the people who are experiencing it. To dig a little bit deeper on what that means, because of our sensor network and the interaction with people at the moment they are perceiving illness, that gives Kinsa the earliest, most accurate, and geographically precise signal of illness. Now, those are the illness dynamics about when it's striking, where it's striking, and what geographies are affected more than others. But because we have this combination of smartphone app along with a smart thermometer, Kinsa actually has multiple data sets which are unique and allow Kinsa to characterize the illness, collecting symptom information, understanding what symptoms are in what geography. Transmission rates. So with 2.5 profiles per thermometer, Kinsa is able to understand transmission rates of illness within schools and within homes. And then finally, because Kinsa is interacting with individuals on multiple days across an illness, the data is present to allow us to understand what is the duration of illness. So are there areas where there's a higher severity of longer term illness? And these are all ways Kinsa's data can characterize the illness. We combine those dynamics and characterization to provide actionable intelligence to companies working in this space. And we do that in really 4 specific ways. Number 1, to understand the illness. So understanding just the impact of cold and flu. Number 2 is helping companies direct advertising and promotion, coordinating where the message is going to be received and actioned on by the higher proportion of people. Third is to have an inventory strategy. Clearly, where there's more illness, there will be more demand. And this is something that happens very quickly. So to be able to be ahead of that, to allow companies to have that inventory available when it's needed. And then the 4th component is planning and adjusting, understanding where in the season a current status exists and make plans accordingly to make sure you can optimize and maximize the opportunity of what is a very short season. Now, the 4th area is what we're going to talk about today. And with that, I'd like to introduce our speaker for today, Brad Pope.
Hey, thanks, Chad. Can you hear me okay?
Yes, I can hear you great.
Fantastic. Yeah, that stat about having children, specifically 2 or 3, being ill 29 weeks of the year, actually sounds pretty nice. I've got 4 little ones at home, and I don't think the house has been healthy since back in August. So it's a sample size of 1, but we definitely feel that. So as you mentioned, I'm going to go through making the illness data retailer specific, and this could be used directly from a retailer's perspective if you sit in one of those seats, or alternatively, if you sit on a brand team or kind of bringing your retailer partner information on illness and how to make it actionable. So for the purposes of what I'll talk through, I'll make it specific to a brand that's bringing information to a retailer. So first, let's look at national illness levels. So with something like this, a good way to start describing illness is always starting at a top line and describing where we are in the season. So as we can see here, this is actually a slice of a PDF that Kinsa regularly puts out as part of our cold and flu tracker. But the blue line up on top represents where illness is this season, and that dotted blue line is the next 3-week forecast. But what makes it interesting is also being able to see a typical season as well as last year, and those are the gray line and the dotted gray lines below. So now we can start to see that this season is more severe than previous seasons, and then it starts to give context around anything that's different. So if there was a way that the season was planned specifically on a national level, or some things that are different than what was originally thought, this is a great place to bring them up from at a top line level. Next, if you look at geographically speaking what's happening with illness, well, there might be some ways that it tracks to the top line map. There's usually a lot more dynamics that are happening under the hood. So for instance, this season, illness really started in the south and was there for quite some time, and then eventually transitioned over to the Midwest, and along the way, the East Coast was impacted as well. So being able to describe how the local or regional illness plays into what was planned for, and any antidotes there, is extremely important. So in other words, if everything was progressing exactly as planned, there might not be any ahas, but things very seldom when it comes to illness do track as planned. So being able to articulate those is important. Next, when we're talking about specific retailers, translating illness into something that's relevant to them becomes extremely important. So in this case, actually translated the previous map into a retailer's DCs. So essentially taking all the stores that are served by those DCs and aggregating the illness associated with those stores up to the DC level allows a retailer to kind of understand from their perspective where illness is happening. So in this case, the map on the upper right is what's going on with illness now, but it's also good to get perspective, like in the lower part of the map, what's going to happen over the next few weeks. So you might see the top DC there, 60-25, on the top map, and it's pretty red. Okay, illness is high, but what does that mean for me in a few weeks? Well, actually, if you look at the percent change in the bottom, the percent illness is coming down over the next 3 weeks, so it might not be necessary to focus there, but if you look at other locations on the East Coast, there are going to be more heavy illness areas that require attention. Next, let's take a look at another way to slice the information by DC. Depends on the retailer and depends on the brand, but a lot of times the forecast is really looking at last year and what happened last year, or even the last 2 or 3 years, and then putting on some sort of increase or add to that. So last year then becomes very important as a baseline. So what we're looking at here on the y-axis, essentially we're looking at the illness levels, and the x-axis would be last year and how that compares. And if you lay that out, anything that's up towards the top is experiencing heavy illness this year, and as it moves to the right, it's experiencing heavy illness relative to last year. So if you then look at anything that falls in that upper right-hand quadrant, that represents where illness is high and where it's anniversarying last year. And for instance, the DC on the far right, illness levels are close to 3x what they were last year. So if a retailer is using last year heavily in planning, having those high illness levels would be a great opportunity to look for inventory that might be low, or a forecast that might not necessarily be tracking as high as they could be. If we look at those same DCs, so we identified 4, but essentially what you can do is plot each DC or trend each DC, so each row here is a different DC. And if we go across a single row, we can look at the last 4 weeks of illness, the current week, and then the forecast itself, so being able to kind of look out in time at what's happening. Then looking at a few KPIs, so for instance, the far right-hand column represents how it tracked last year, so over 300% higher than it was last year, which seems high, but if you remember what we started with in our national chart, that's actually that's actually very feasible for a season like this one. So being able to sort, slice, dice, and then look at relevant retailer DCs and how they're trending becomes really important when you're doing reviews of forecasts, orders, and really making sure that your retailer partner has what they need in the pipeline. So if we also want to go down a level, if you're doing that sort of detailed work, Kinsa also maps individual stores back to the illness level in those areas. And then by doing that, if you ever need to make a recommendation, or if there's some sort of push, being able to get to store level to describe the illness that the stores are going to experience in the coming weeks helps kind of justify the recommendation and makes it a fact-based approach versus more of a qualitative top level. This area of the country has higher illness, so this makes it much more surgical. So when our customers use this, and they've used this both internally and at retailers, essentially it makes them more effective at what they do. Being able to not just talk about what's in the news or illness at a high level, but being able to describe illness at that very low level of detail allows them to make much more compelling stories and be consultative advisors. And ultimately, as you see in the second bullet there, make more educated supply chain decisions. So for us, this is really the illness portion of what we do, and being able to make that illness very, very retailer specific and very local as is needed to get the job done, if you will, and help our customers get in front of get in front of that illness and also be prepared for rest of the season. But what we also do is translate those illness levels, as Chad mentioned, into consumption or sales forecasts. So if you think of being able to go have a very similar conversation, but this time describe what the actual sales quantities are expected to be based on what we're seeing from an illness standpoint, it makes for a much easier to understand conversation and take some of the translation work out, which is an important step. And then last but not least, being able to align on what exceptions look like. So, when will illness information reach a threshold that we want to make sure that is staying in front of the retailers, whether that's an inventory level or forecast differences. But in future webinars, we'll talk through both those, the sales demand as well as the inventory exceptions. And with that, Chad, I'll turn it over to you.
Great.
Chad,
thanks, Brad.
You betcha.
And so if anybody has questions now, feel free to post them to the chat, and Brad and I will be available to answer them. It looks like we have a couple coming in already. So the first question, Brad, you might want to take this one. How does your signal / the number of inputs compare with other sources like CDC or FAN?
Yeah, sure. So CDC, it has about a 6-week lag by the time everything is completely restated. They might have an earlier signal that's out, but we have noticed that changes quite a bit. They have between 2,500 and 3,000 clinics that report in their numbers. And with that, they'll receive 40,000, essentially illness signals a week. During our peak season, we'll receive 50,000 signals a day coming in from all the Kinsa devices that are out there. So, and that is real time. So by the time that we aggregate those up, it's really previous day's information that's populating all of our dashboards, et cetera.
Great, thanks. So the next question is regarding the forecast, and it says, with a 3-week forecast, what are the types of actions customers are taking? I'll go ahead and answer this one. And because of the time horizon of the 3 weeks, I should state up front, we take a rigorous approach to providing a forecast. I'll let Brad talk about the accuracy, but what I can say in terms of what customers are doing with this is the things you can imagine operationally that can occur within that 3-week window. So number one is inventory adjustments, whether that's between DC and DC for positioning purposes, or perhaps between DC and store to make sure there's sufficient quantities available for demand. That's a major factor. A second element that our customers are using with the forecast and the real-time signal is for digital marketing, for advertising purposes, for directing those campaigns automatically to the areas where illness is highest and growing, as opposed to the areas where illness is lowest. So making sure your dollars are spent most effectively. That's number two. And then the third is a lot of the stuff we spoke about today. So it's planning that goes on between retailers and CPG brands with respect to where an inventory should be placed, what orders should be placed to make up for consumption that's going to occur. So those are the three things that really customers are using with that 3-week forecast horizon. Brad, do you want to make a comment about the accuracy of the forecast?
Sure. Yeah, we're within a few tenths of a percent of what's actually happened. So essentially, if you look at our 3-week and then you let the rest of history catch up, we're within a few tenths of a percent 3 weeks out. When we did our initial work on looking at our forecast accuracy, we were 2 to 4x industry standard, so we were pretty happy with that.
We have one more question of how do you determine store location details for various retailers, and what retailers do you provide locations? I'll take the second part of that, and I'll pass it back to Brad. But essentially, we can work with any of our partners who provide the locations of the store and distribution centers. Right now, we regularly have those for Target, for Walmart, for Costco, and for Whole Foods. But again, depending on what customers you're working with, and we have a zip code, we can make those maps occur. Brad, do you want to talk about specifically how we end up inputting those and mapping them?
Yeah, absolutely. So we take the zip code that's associated with the store and summarize it essentially by county. So we assign the illness level at the county that the store is in to that store through its zip code.
So another question, can you disclose some of your customers, either retailers or CPG brands? Certainly we can disclose the brands with whom we have public announcements. And so we've worked both with Clorox, which is the case study which was shown earlier today, also Mucinex and Lysol with RB, and with Boiron, several others which aren't publicly disclosed, but we can say we've been working with a large national drugstore chain and several other large national retailers. All right, if anybody has any more questions, feel free to send them in. If the question line stays blank, then we can go ahead and wrap, but I'll wait on a couple of minutes here so people can have a chance. All right, I haven't seen any questions come in, so instead of hanging on for another 6 minutes, why don't I thank everybody for attending. Hopefully this was a useful session. As I'd mentioned, we will be following this webinar with 2 additional webinars in the series, making the progression that Brad had mentioned. So number 1, talking about turning illness into a demand signal, and then finally talking about those exceptions. We hope everybody enjoyed the session today. We hope everyone will join us in the future, and thank you for attending.